Prolapse is a condition where organs drop through the vagina due to lack of support. It could be the bladder, the uterus, or the rectum. And each has a different name to it. Regardless, it's like having your bottom fall through a hammock. And that needs to be repaired back in place if it bothers the patient. There are many women who present with a sensation of something falling out, a pressure sensation, low back pain, and urinary symptoms. This can be difficulty in urinating or difficulty controlling urination with cough or sneeze. When we evaluate the patient, depending on the organ that has prolapse, we would treat it appropriately. In general, if the uterus has dropped significantly, the patient would be recommended a hysterectomy in most cases, and that is done vaginally. In select young patients, the uterus can be put back in place and fixed, but in a majority of patients, that would be removed. And the rest of the pelvic floor or the support mechanism needs to be repaired. There are different ways to repair this. You can use patient's own tissue to repair it. However, it is weak to begin with. Repairing the weak tissue is like tying the strings on a hammock that has broken through. Now, it'll be good for a very short time, but if you lie down on it again, it'll break again. So to repair it, we generally like to put a sort of a piece of a cloth on that hammock to repair it. We use a piece of mesh, whether synthetic or biodegradable, depending on the patient's condition, to repair or replace the hammock and then fix it in place. Most of this surgery can be done vaginally. 99% of the time in my case, I do that vaginally. However, it can be done abdominally through an abdominal approach or even robotically or through a laparoscope. It is much easier to do it vaginally for me based on my training, and the patients generally go home overnight with or without the catheter, depending on their urinary situation. This prolapse I have treated for more than a decade in my experience using the mesh, and majority of the patient in our published results, over 90% of the patients have done well 5 years and beyond when we reported the results.